MRSA is a life-threatening flesh-eating bacteria most often acquired in hospitals. It kills more people per year than AIDS. It is called a superbug because medically it is very hard to stop. Nearly 19,000 Americans died from MRSA in 2005. This killer infection is frequently acquired in hospitals but also in public places now. A mother in Eugene, Oregon had a son who caught MRSA. Medical treatment was failing, as it does for thousands of people with MRSA. All on her own, with no medical or professional guidance at all, Christy found the solution. What stopped this killer bacteria? An inexpensive, effective, life-saving GNLD product with no negative side effects whatsoever.
Okay, MRSA it's called the superbug. You probably heard it on the news. It's a flesh-eating bacteria, and no antibiotics can touch it. That's why they call it superbug. So they keep prescribing antibiotics to people that have this, and they keep coming back with outbreaks, and they're real painful welts that come on the body, sores, and they seep pus and stuff, and that's real highly contagious. And my son, he is 8, and he got MRSA, and he had it for a while. We kept taking him to the doctor. They kept getting him antibiotics, pretty heavy doses of antibiotics. And so we would finish the antibiotics out, and then another 2 days later, after the antibiotics we were finished giving it to him, he'd come out with another breakout. And so then I heard about garlic and the allicin in garlic, and I thought I'd give it a shot. And I actually used this product right here, and we gave him about 6 of them each night, and within a month he didn't have a breakout. And we continued that for about 3 months or so. And he hasn't had any breakouts. And so we're going on about 8 months of no outbreaks or anything.
Wow. And MRSA, it can be life-threatening, correct?
It'll kill you. It's killed people.
MRSA kills thousands of Americans each year. In hospital deaths among patients with MRSA, we estimate that 94,360 invasive MRSA infections occurred in the USA in 2005. These infections were associated with death in 18,650 cases. It's from Journal of the American Medical Association, October 2007.
Oh, he's fine. He's done. He doesn't have any symptoms. He's real happy, normal 8-year-old.
Wonderful.
Yeah. This is my son that had the MRSA, and as you can see, he's happy. Are you happy?
Yep.
You're happy. Healthy kid.
How do you feel now?
I feel great.
And were you in pain before, or just real weak, or what?
Real pain.
A lot of pain?
Yeah.
Wow.
And whenever it hit something, it got a huge bruise.
Really? Was that from the MRSA, or was that from the medication, do you think?
I think it was MRSA.
You do? Okay. Okay, well, we're happy you're doing better.
We're happy too. It's great.
You like the garlic? Are you happy what it did?
Yep.
Good.
Yeah, so I called everybody in the phone book because I couldn't find the amount of allicin that I needed, and I even called Minnesota, and they had it, and they wanted to charge me for, for 2 months. They wanted to charge me $850. It was an outrageous amount, and this was the very last number I had to call was your office, and you had it, and it was a miracle. It was the last one. I was about ready to throw my arms up and go, I don't know what else to do. And so when we found it, I was real excited.
And how long did it take Christy to, tell that it might be working?
After his boils healed, the ones that he had that were already on his body, after those healed, it was probably about 2-3 weeks when we didn't see an outbreak. We figured out it was working, and so we just kept him on it for about 3 months or so just to make sure, and it's wonderful. Yes, and they also have it in schools, in the locker rooms and stuff, and so that's why you'll hear them. They changed their policy at schools to keep everything clean, and their jerseys, and they're always sterilizing everything, and so that's what MRSA is. That's the same thing. That's the superbug that they're talking about.
Okay, and that's a flesh-eating bacteria.
Exactly.
Wow. Okay, we're so happy you found it.
Oh, so am I. It's wonderful.
Yeah. Okay, thanks, Christy.
Thank you.
From Prescription for Nutritional Healing by James Balch, MD, garlic is a natural antibiotic. It's a potent immune system stimulant. It lowers blood pressure, lowers cholesterol, lowers risk of heart attack by preventing blood clots, helps fight many diseases, including cancer.